right now. Okay, we should be recording and we'll begin here shortly. All right, it is 12 o'clock. Hello and welcome. My name is Brad Lastly. I'm a physician assistant who specializes in liver disease. I work at Advent Health Medical Group Fatty Liver Clinic, of which you guys have mostly met me. Also with me today is Adrienne Shepard. She is our nurse navigator at our Fatty Liver Clinic. And we have put together a series of webinars that are primarily focused around education. And it's a series of 4. We are on our second part. We'll have part 3 and 4. And then we will begin the series over again once we complete the 4-part series. These webinars will occur once a month, usually on the first Friday of the month from noon until 1 p.m. They are also recorded. And when you receive the emails inviting you to join us for our next and upcoming webinar, you will see a link to the archived lectures or webinars that have been completed in the past. So welcome, we're glad you're here with us today. We're excited to kind of navigate a little bit more about liver disease. As far as the expectations, we'll reserve the questions until the very end. For those of you familiar with Zoom, you're able to utilize the chat feature to put your questions in the chat. Or if it's easier for you, we can definitely have you unmute your microphone at the end when we do questions, and you can ask your questions at that time. We'll be happy to entertain those towards the end of the hour. All right, so today we're really going to be exploring how do I make changes now to avoid long-lasting consequences in regards to fatty liver disease. So we talked in our first series about fatty liver disease, non-alcoholic fatty liver disease, or NAFLD, and non-alcoholic steatohepatitis, or NASH. Now we're going to really kind of get a little bit more background about what are the causes of fatty liver disease. So we know that fatty liver disease is a direct consequence of someone's sedentary lifestyle associated with high blood sugar and high fat diets. So we know that when you consume sugar or simple carbohydrates, such as white breads, white pastas, that sugar or that starch is transformed into a sugar, and the sugar then is transformed into fat by your liver to be stored and used when needed. One of the functions of your liver, one of the many functions, is to process and package fat. Everyone's liver does it. So at some point in everyone's life, you will have a degree of fat at your liver. That is a normal physiologic process. However, when we have diets high in sugar, high in fats, or high in simple carbohydrates, as I had mentioned, white breads, white pastas, for example, those foods are turned into sugar, sugar turned into fat and stored, and only to be used when needed. When dietary sugar and fat intake is too high, the liver produces and stores fat then in excess. So while part of the job of the liver is to store and package fat to utilize as energy, if you're eating too many calories or taking too much sugar or fat in, and you're not exuding or you're not kind of losing those calories through exertion or energy burning, such as through exercise, then that will store fat in excess around the liver and over time create non-alcoholic fatty liver disease. So risk factors for fatty liver disease are people who develop fatty liver disease would be someone who's classified as overweight by their BMI. While we recognize in medicine that there are limitations to a strict calculation of BMI, especially in our robust muscular patients, BMI can be a little misleading, so keep that in mind. But overweight individuals have a BMI of 25 to 30, and then anyone with a BMI greater than 30 is classified as obese, Within that obesity classification, there's a few different levels, obesity class 1, 2, and 3, that we really look at to see the severity of someone's obesity. Type 2 diabetes also puts someone at a greater risk, especially poorly controlled type 2 diabetes, where their blood sugars or blood glucose is too elevated, which you can kind of determine that by a blood glucose level or a hemoglobin A1C that sometimes your doctor will draw, or just a finger stick at home to measure your blood glucose. Insulin resistance, where your body is no longer responding to the insulin as it should. A lot of times we will refer to this population as a pre-diabetic. And then metabolic syndrome is also something that we really consider to put our patients at risk for developing fatty liver disease. So what is metabolic syndrome? It's actually a combination of biochemical and physiologic disorders indicating a dysfunction of someone's metabolism. So an individual is diagnosed with a metabolic syndrome when they have 3 or more of the following that we're going to discuss. So if you've been diagnosed as overweight or obese, other people like to classify this as like a large waist circumference, or sometimes that apple-shaped appearance. That definitely could be one of those categories. So overweight or obese, which is really classified by that BMI scale that we just went over. Someone who's been diagnosed with insulin resistance or type 2 diabetes, mellitus. High levels of the bad cholesterol, which is LDL, low density lipoproteins, or low levels of the good cholesterol, which is a high density lipoprotein, or HDL. High levels of triglycerides when your medical provider draws your lipid panel. This is essentially the free floating fat in your blood. So the triglycerides is really measuring how much fat is present in the blood. And then your liver will filter the blood, and as it filters that triglyceride out of the blood, it will deposit that then in turn into the liver. And then high blood pressure, or also known as hypertension. So if you happen to have 3 or more of those listed, you would be diagnosed as or eligible for the diagnosis of metabolic syndrome. The American Academy of Medicine has actually suggested that 2 or more should be a better indicator. So if you have 2 or more of the bullets below, you may be moving towards or have a true diagnosis of metabolic syndrome. But the current infrastructure is that it's 3 or more. All right, so symptoms of fatty liver disease. This is a question we receive often by our patient population. Fatty liver is actually a silent disease. So most patients, especially in the early stages, feel no symptoms at all when they have fatty liver. Most fatty liver disease is identified incidentally or in those with high suspicion, such as a patient with poorly managed diabetes or poorly managed triglycerides or cholesterol. Incidentally means that we found it when looking for something else. For example, someone is complaining of abdominal pain, they have an ultrasound or a CT scan, and it demonstrates that their liver has evidence of fat on that image. So that's an incidental finding. They were looking for a cause of abdominal pain, and whether they did or didn't find that cause of abdominal pain. Incidentally, they were able to identify that there is something called liver fat, or hepatic, which means liver, steatosis, which means fat. We know that in the advanced stages of fatty liver disease, in advanced stages of liver disease itself, some patients may feel some symptoms, and we'll talk about those, but moderate pain or discomfort in the right upper quadrant of the abdomen and fatigue. We'll unravel that a little bit more. So again, a little bit more on the symptoms is that you need to understand that your liver doesn't have nerve endings. So a lot of people will complain of right upper quadrant pain who have known suspicion of fatty liver and believe that it's fatty liver that causes their pain. The reality is that that's likely not the case. Individuals who develop fatty liver disease, these people over time, if that fat rests there, again, over a period of time, it can cause the liver to become inflamed. So non-alcoholic fatty liver disease is the presence of fat around the liver. When the liver becomes inflamed as a result of the fat being present over a period of time, That's called non-alcoholic steatohepatitis, which means the fat at the site of your liver has led the liver to become inflamed. So now we call that a steatohepatitis, or inflammation of your liver as a result of fat over time. This is where it becomes dangerous. What happens is when people develop non-alcoholic steatohepatitis, or inflammatory change to their liver, that inflammation over time can lead to scarring. That scarring is known as fibrosis. And scarring can worsen, again, if the fat is not addressed at the side of the liver and the inflammation subsequently is not reduced. You will develop scarring at your liver. We also call liver scarring, again, fibrosis. Fibrosis is scored on a scale. F0, fibrosis stage 0, F0 is no scarring on your liver. That's what you want to be. F1 is a little bit of scarring, kind of superficially of the liver. F2 is a little bit more, fibrosis stage 2, a little deeper. Fibrosis stage 3, we also call this advanced fibrosis, and fibrosis stage 4 is known as cirrhosis. So when we see symptoms associated with fatty liver disease, it's more commonly associated with advanced liver disease and not specific to the actual fat accumulation around your liver. So if you have fibrosis stage 3 as a result of the inflammation that's led to scarring from fat, or fibrosis stage 4, you likely will develop more symptoms such as loss of appetite, swelling in your lower extremities or your legs, confusion or slurring of your speech, yellowing discoloration of the skin and the eyes, fluid accumulation in the abdomen, also known as ascites. But again, these symptoms are associated directly with advanced liver disease. So the symptomology usually presents itself as a result of advanced liver disease and not the fat accumulation itself. The fat is the culprit, but that's caused advanced disease, which has led to symptoms. Like this is sometimes when I mentioned the pain, sometimes what can happen is individuals will develop a mass in their liver because of advanced fibrosis or cirrhosis. Anyone who has advanced scarring or fibrosis stage 3 or 4 of their liver, they're at an increased risk of developing a liver primary cancer known as hepatocellular carcinoma. And sometimes when individuals develop a mass within the liver itself, it actually, depending on where it's located, if it's located towards the surface of the liver, there's a capsule. And if that capsule of the liver retracts, that sometimes can cause pain. Again, not very common do we see capsular retraction, but usually it's associated with mass occupation at the site of the liver. Again, take-home message here, fatty liver itself is usually a silent disease, but if you develop an advanced scarring of your liver known as fibrosis stage 3 or fibrosis stage 4, also known as cirrhosis, your symptoms are most related to the advanced liver disease and not the fat itself. Fatty liver is a progressive disease. So it's estimating the disease progression rate is actually quite difficult because it varies from an individual, from one individual to the next. So, but what we do know in progressive disease is that individuals gaining weight or worsening of diabetes are known to accelerate progression of fatty liver, again, to NASH, the inflammation, leading to fibrosis, advanced fibrosis, cirrhosis. And as I had mentioned, those individuals with advanced scarring or cirrhosis are at an increased risk of developing a liver cancer, hepatocellular carcinoma. We know that developing NASH also increases the risk of developing diabetes or worsening its control. So again, fat accumulation around the liver that's caused inflammation to the site of the liver actually kind of diminishes the liver function. And your pancreas, in conjunction with your liver, helps in processing and developing kind of blood glucose or sugar, right? So how we process blood sugar. So again, the fat causing inflammation to the liver cells diminishes the normal ability or the natural ability to process sugar appropriately, which could then worsen someone's diabetes. Fatty liver disease is far more than just a liver disease. And this is something that we really have to drive home. You know, liver disease is at the center of all metabolic processes within our body. You know, I'm a liver guy, so I really get excited about the nuance of science and liver disease. I don't know that most patients care about that nitty gritty. So we're going to kind of talk about more the public health approach to this. So when fatty liver develops into that inflammatory response of the liver known as NASH, the liver is damaged and inflamed, and it releases these little molecules into the bloodstream that can especially be harmful for someone's cardiovascular system. It's almost like waste product or plaque. The main cause of death in patients with non-alcoholic steatohepatitis, or NASH, is not actually liver-related complications. It's actually cardiovascular disease, because you've diminished the liver, which really is really the engine that drives metabolic process, which can lead or promote the disease and illness of other main vital organs, such as the heart or your vascular system. So how can I help myself? That's another question that we get often, right? What can I do to make this better? So lifestyle changes, right? And this is the hardest prescription to give any patient, right? So as patients, we're used to going in, you have a sore throat, you have this illness, you see a medical provider, they give you something in the form of a drug or something like that. You take it for a couple weeks, you get better, right? That's what you're used to. You come to our clinic, and yes, there are medications that promote weight loss, and we went over some of those this last time. However, the largest prescription that we give is really a lifestyle change, which is not an easy thing to ask someone to do, but it's a journey. So how do I help myself? Those patients with fatty liver disease can avoid or slow down disease progression by changing their lifestyle. So efficient, and what's important here is the word sustained. So it has to be an efficient and sustained lifestyle modification through diet, exercise, weight loss. All of these can have a positive impact on fatty liver disease, reducing the incidence or prevalence of steatohepatitis or NASH, which then in turn, if you get rid of that fat and you get rid of the inflammation, your risk of scarring or fibrosis goes from elevated to none, okay? If you get rid of the inflammatory change, you get rid of the fat at the side of your liver, you will not progress to hepatic fibrosis as a result of fatty liver disease. So losing weight and sustaining the effort can be a huge challenge, and it can be very demanding, especially in Western culture. You know, our lives are centered around busyness. Our lives are centered around kind of expectations and production. And sometimes, you know, we may just not have the mental capacity to be able to do that weight loss and be sustained, because it's frustrating, especially if you have other conditions that prevent you from easily losing weight. So you may feel powerless at times, and it feels as though you're facing this great challenge that it's much easier just to ignore it and then accept the kind of road ahead of you than it is to actually work towards getting better. But that's not a great option, because you can do something. You can empower yourselves. You can surround yourselves with support people, and we'll talk about that. But if you have difficulties overcoming the challenge of weight loss or sustained weight loss, do not feel guilty or discouraged. You've got to seek support. And we're a good first step for that. While we're not dietitians, we're certainly people who are here to help you along that journey. And we will both carry that burden instead of you doing it yourself. While you do the heavy lifting, we're there to support you. The real challenge, again, is maybe not even losing the initial weight, but to keep it off once you have lost it for long periods of time. This is not a diet. We're not saying go on a diet for 2 months and then you'll be all set. We're saying let's make small changes to your daily routine, okay, that are sustainable, so that we can actually make this lifestyle adjustment forevermore, not just for a set or designated period of time. A lot of our patients suffer with cyclical weight loss and gain, where they'll lose weight. They're very, very dedicated. They're very restrictive in their diet. They exercise to the point where it makes them sick sometimes, and they do successfully lose weight, but then they grow discouraged because they've not created a sustainable lifestyle that they can keep going for months to years on end. So they kind of fall back into old habitual ways, which is very common for adults. So good habits can ensure you start the journey on the right foot. So here, let's talk about some helpful tips of how we can do this. So cooking our own meals, right? It's recommended to cook from scratch as much as you can to keep an eye on what is actually in your plate and what goes in your body. I also get that this is not always possible for some. So, you know, people say, I do not have time to cook from scratch every meal. what we recommend is that you find the day, a day off that you have, or a set period of time, maybe it's 4 to 6 hours, and you do meal planning for 1 to 2 weeks at a time, so that you kind of make this food from scratch. You know what you're putting in your mouth, and you set aside time for that, just like you would for your 11 o'clock or 12 o'clock appointment. You schedule that time out. Consuming whole foods, right? Foods that have grown from the earth and have not been adjusted, or roam the earth and have not been modified or adjusted. Avoid processed foods, because processed foods contain high levels of added fat, salt, and sugar, even products that don't taste sweet, right? The preservatives to keep them whole, to be in a box for 6 to 12 months, or to be in a box for 6 to 7 years. Those things require additional salt, fat, and sugar just to keep them preserved. So cooking your own meals, okay? Know what you're putting in your mouth. If your life doesn't allow you to cook daily, try to do meal preparation. That's a good focus. Reduce your fat intake. So it's advised to grill meats. Grilled, baked, broiled are all better. Deep fried or fried is not a good option. So grill meats, you can broil them or bake them. Fish, shellfish, if you like that, and preferably use oils that are rich in unsaturated fat, such as flaxseed oil, olive oil. Those would be good options. Control your portions. This is another thing that is difficult for a large percentage of patients. So a balanced plate should be divided. And I have this little plate diagram to my right, which is not something that I or our clinic has developed, but our colleagues developed at the Harvard School of Public Health, and it's known as the health eating plate. And it gives you a breakdown in proportions about which foods should you fill your plate with, okay? Coupled with healthy oils, consumption of water, activity, we should focus the most of our plate, or the most of our daily intake, on vegetables and healthy proteins, supported by whole grains and fruits. So the more veggies and the greater the variety of veggies, the better, right? We don't really count potatoes, French fries, those types of things, but this is the largest section of your plate. And don't hear me wrong, one of the things that's a good kind of tip for portion control is to buy a smaller set of plates, or to have a smaller section of your plate dedicated. I mean, think about it. The plates that we use are massive. A lot of people will not just fill up the plate once, but they'll fill it up multiple times. Okay? Not everybody, but if you have a smaller plate to start, or if you use a bowl instead of a plate when you put your food together, sometimes you will take less food. If you're going out to dinner, again, we don't recommend eating out often, because you don't know what's going into your body. You don't know what's in the food preparation, oils, fats, and salts. But if you go out, ask the waiter to literally box up half of that meal for you before they even bring it out, or after they do, so that you don't have that extra food in front of you. Healthy proteins, fish, poultry, beans, nuts, those are all things that we promote. Again, grilled, baked, broiled. Red meats and cheese, you want to limit those, okay? Again, high in saturated fats. Avoid bacon, cold cuts, or other processed meats completely is the recommendation. When we talk about whole grains, so eating a variety of whole grains is good. Whole wheat bread, whole grain pasta, brown rice. Here's the caveat. Our patients mostly struggle with diabetes, right? And so we actually ask that you even limit the whole grains more than someone would in the absence of diabetes, because as I had mentioned early, individuals who consume diets high in carbohydrates or starch, even if they are whole grains, your body will take that excess and process it as a sugar and store that sugar excess as a fat. So the one thing that we do want to do is limit how much carbohydrates that we're taking in. We call that a low glycemic diet. Our diabetic patients are usually most familiar with that, but we're not saying eliminate it altogether, because you do require whole grains to help you with your energy stores for the day. But you definitely want to completely, I know on here it says limit the refined grains. We say exclude the refined grains, such as white rice, white bread. Fruits, this is another caveat. While we do say eat a variety, eat a multitude of colors of fruits, they're healthy, you have to be careful, because fruit has a lot of natural sugar. It's called fructose. And your body doesn't necessarily recognize it as any different of any other type of sugar. So if you're eating 3 watermelons a day, or the whole bag of pears, or 3 containers of blueberries, you too will deposit fat around your liver, even with healthy food. So I'm not saying eliminate fruit. What I'm saying is make sure that your diet is rich in vegetables and lean protein, and that you kind of adjuvantly add to your diet kind of those fruits in a portion size that's manageable. So have a serving of fruit a day or twice a day, that's okay, but you don't want to the excess, right? So we worry about people who are having 2 or 3 or 4 smoothies a day, because that's a lot of sugar for someone to begin. We prefer the fruit to be something that has the fiber from the skin, like the skin of the pear, the skin of the apple, those types of things. All right, so drinking water, this is another thing. A lot of patients tell us, I can't drink water, I do not like the taste of water. Water makes up the majority of your total body, right? So total body water is a large portion of a human existence. So hydration is essential. So drinking water throughout the day will keep you hydrated. We are okay with natural flavorings such as fresh lemon or mint or cucumbers to give that water a fresh and flavorful taste. So that's kind of our answer to people who don't like the taste of just water. Staying hydrated reduces the feeling of hunger. So it gives you that satiety, or that sensation of that you're actually full. So drinking adequate amounts of water throughout the day will help you avoid any unnecessary calorie intake. So when you feel hungry throughout the day, drink water first and allow yourself time to kind of feel full with water before you substitute that with any other snack type foods. If you were to choose a snack, we recommend things such as celery, which is a net 0-calorie food. There's 0 calories essentially in celery, but it allows you to have that oral fixation of eating and chewing and swallowing. Unsweetened black coffee or black or tea, you can be black, green, or white, doesn't matter, is also appropriate if you want to have something to drink other than water. So no added creamers, no added sweeteners, strictly black coffee or tea. Here's the caveat. This is okay for the liver, right? So people who have propensity with palpitations such as atrial fibrillation or cardiac issues, we recommend, of course, decaffeinated coffee if you want that, because the caffeine can cause palpitations, especially in those individuals with cardiac disease. So be careful. We're not saying that all patients can have caffeinated black coffee. We are saying that for liver health, it is appropriate. And there are some studies that suggest black coffee can help reduce the incidence of fatty liver disease. But again, our cardiology colleagues may not agree that caffeinated coffee is the best thing for every patient. Avoid all sugar-sweetened beverages. That includes juice. A lot of, obviously our alcoholic beverages contain quite a bit of starch, especially the beers, and then sugar, especially these wines. And of course, we're liver people, so we say not only to avoid all sugar-sweetened beverages, but also all alcohol. If we had it our way, we would have you drink water and water only, and we would be okay with black coffee or tea that isn't sweetened or cream involved. Snack healthfully. So nuts, such as walnuts and almonds. Choose the nut that you like. These are a good source of protein and keep you full longer. So protein actually helps you feel full for a longer period of time. Again, celery, as I mentioned, is a net calorie 0. That's not going to make you feel full. It's just going to help take care of that crunch, take care of that something in your mouth, that oral fixation. But we do recommend that all calorie consumption should be avoided after 7 p.m. And that's all calorie consumption. So anything that contains a calorie, whether it's a food or a beverage that contains a calorie, because how you process calories during the daytime when your body's awake and it's using that energy, at nighttime, your body is kind of shutting down for the day. And so it's not consuming or utilizing as much energy. And so that additional calorie consumption will actually lead to further weight gain quicker were you to consume the majority of your calories at night. And this is frustrating for patients because our culture is situated in a way that says, all right, dinner's our largest meal. We're going to get together as a family. We don't get off work until 5. The traffic puts us home at 6:20. We prepare the meal. We sit down at 7:20, 7:30 to have dinner. We understand, we too live in that same culture, but it's something that you have to really work towards. You have to work towards making those meals earlier. You have to be intentional with meal preparation so that you can cut off that calorie consumption by 7 p.m. We also are very aware that people work different hours. So the third shift individuals, the second shift individuals, and these individuals are the ones who struggle even more because there is a component of weight gain and circadian rhythm and the hormone imbalances that exist in individuals who don't sleep at night. Eating slow, yes.
Okay, I hate to interrupt you, but we have a wonderful question about artificial and natural sweeteners.
Yes, so that's a great question. So what I can tell you about artificial sweeteners is we don't know what it does to the body on a cellular level. So while we know it doesn't have those calories that we are talking about that would kind of promote fatty liver disease, we know that it confuses the cells on a cellular level. So in my research before coming down here to Florida, we looked at this quite closely, and we noticed that artificial sweeteners are not a good thing for our intercellular selves, okay? So we recommend against them from a medical standpoint. Natural sweeteners, when we talk about those like turbinado or kind of unrefined sugars, we know that that type of thing can definitely still lead to that sugar overload, which stores extra fat. And then stevia. Stevia is also quite interesting. So it's kind of a balance between turbinado, which is that unrefined natural sugar, and the artificial sweeteners. It behaves similar to both. So our recommendation is that you avoid both of them, to be quite honest. Now, if you care for like carbonated beverages, for example, like there's a lot of name brands out there. I don't mean to pick on anyone, but I know my wife likes the bubbly brand, right? And she likes the lemon lime kind. So if it doesn't include natural sweeteners or artificial sweeteners, and it does include flavor from the natural fruit, we're okay with that. But we tend to say, let's avoid these artificial sweeteners and these natural sweeteners as best as we can, okay? Molecularly, your body does better with sugar itself than it does with these artificial kind of synthetic created type sweeteners. However, fatty liver people don't do well with excess sugar. Does that answer your question at all? Excellent.
Okay, good.
All right. So your stomach needs at least 20 minutes after the beginning of the meal to send a message to your brain that you're actually full, okay? If you eat too quickly, you may actually overeat. So think of this, it's happened to everyone, right? So you go somewhere, it's a meal that you really like or food that you really like. You start eating and you still feel hungry because you ate quite quickly, it just tastes so good, or maybe you were hungry because you skipped over breakfast and lunch, and then you go and get a second helping or a third helping, and then you eat, and then you start feeling full. You've had all this food, and then you feel so full that your stomach hurts and that you want to unbutton your pants. So allow the chemicals, allow your brain to be signaled that you're full and to tell your stomach to stop eating. So by slowing down, okay, how quickly you eat will actually minimize how much you eat and actually can help you, and it can help you kind of with portion control. So your stomach needs at least 20 minutes after the beginning of a meal to send a message to your brain that you are full. Some recommendations that we give patients to accomplish this is if you are going to know that you're going to be eating in the next like half hour or so, we recommend maybe even having a few nuts or something to get that signaling going so that you're already ahead of the game, right? Your brain is wanting to send the signal. So go ahead and have a consumption, or like a sugar-free type yogurt or something small that's going to start that signaling process. So eating slowly or starting that process sooner with a few nuts or something like that can help with that process. So grocery shopping pearls. So when you shop for groceries, make sure you are carefully reading the labels on the foods you buy. This is frustrating. It takes a lot of time for patients to be able to do this. They kind of lose hope in this process. So make sure you're carefully reading these labels. But the good news is that after you've read them for a few times, you kind of learn what's in each product, and you're going to kind of train yourself as to which things you should or shouldn't buy. But the ingredients listed describes ingredients in the order of weight. So the main ingredient and the product are listed first. So if you pick up something in your cabinet tonight, I want you to kind of look, what are the things listed initially? If it's high fructose corn syrup, that means the majority of the weight of that product is truly corn syrup. Okay, so they're listed in, the ingredients are listed in a way of weight. So in the product, the thing that's mostly in the product is listed first. Sorry, I didn't communicate that well. So the ingredients listed describes ingredients in the order of weight. The main ingredients in the product are listed first. That's what you have to know. So for example, if the first ingredient on the list is butter or oil, the fat content of the product is probably very high. So keep that in mind when you're looking. You don't necessarily have to know what all of those ingredients are. And the likelihood, if you see an ingredient and you've never heard of this, or it seems like a very large scientific word, that's likely a preservative or an additive that you likely don't need in your food. So that's why we recommend, if it's grown from the earth, or it's roamed the earth in its natural state, these would be the whole foods we recommend. So we know that there's also mobile apps that allow you to scan product labels that will analyze products and indicate their nutritional quality. Some of them are listed here. So like Open Plate, Shop Well, Calorie Counter, which is a food diary. There's another brand called My Net Diary, which does both calorie counting and a food diary. So there's options. These are just a few of them. And you can scan the labels and it can tell you about their nutritional quality, which is a very nice thing. We also recognize not everybody is really savvy or has a smartphone, which is also okay. You would just have to kind of just read them manually. But if you do have a smartphone or you prefer to use a smartphone, that can be helpful. So when grocery shopping, you probably have heard this before, concentrate your efforts on the periphery of the store. This is where you have vegetables, fruits, meats, and dairy, while avoiding everything in between, which is your processed foods like cereals, chips, sodas, and processed grains. You know, it's really kind of part of our culture for everyone to put a non-GMO, organic, you know, none of this, none of that. But don't just trust the little picture on the processed food. Flip over, look at the ingredients, and then understand that if you have harmful ingredients at top or ingredients that are high in fat or high in sugar, this would not be a good option for you. Exercise. So we know exercise promotes well-being, but also offers a better physical shape, weight, blood sugar control. It reduces cardiovascular risk. So exercise is any movement that leads to energy expense. A lot of times people think that we're asking them to join the Tokyo Olympics. We're not. We're simply saying be more active than what you currently are. You need to expend the energy. Low intensity exercise would be things such as gardening or walking, things that expend energy, right? Calories in versus calories out. If you consume more calories than you burn in one given day, all the excess, that net excess, is stored as fat. So if you burn the same amount of calories that you've consumed that day, then you have a net negative. It means you're not going to gain weight or lose weight. But if you burn more calories than you consume in a given day, you have the exercise ability to be able to lose weight. Moderate intensity is like things such as swimming or slow jogging, yoga. High intensity tennis, cycling, running. We do recognize that there's a lot of patients who are very limited by debilitating illness or disease. Maybe they've had recent knee surgery. Maybe they have a chronic joint condition or an inflammatory condition, and none of these may be a good option for them. So what we recommend is finding ways within your limitation. For example, finding resistance bands or buying them, you know, you can buy them very cheap at, you know, like a Walmart or a Target, and using resistance bands to kind of contract those muscles. Using isometric exercises while you're sitting, contract your abdominal muscles, and that would prevent you from having to get on the floor, because some patients may not be able to either get on the floor or get up if they've already gotten on the floor. So finding creative ways, if you don't have the funds to buy hand weights, go and grab some cans of food from your cupboard and use those while you're sitting down on the couch. Or, you know, if you can find ankle weights, if that's within your limitation, do that. Find ways to expend energy. So if you're saying, listen, I work 16 hours a day, on your walk from one place to the next, or anytime you get in and out of your car, if you work if you drive a lot for a living, do 25 calf raises. So just make it a point. Anytime you do a certain activity at work, you do this. So if now you're working from home remotely in this new COVID culture, you need to make sure that you stand up, set an alarm on your phone, stand up every 10 minutes, do calf raises. walk back and forth in the room 10 times. Anything that you can do to expend energy is better than nothing. So I believe that the majority of individuals have the opportunity to modify exercise to accomplish it at some point. We know that the World Health Organization recommends a weekly exercise practice of 150 minutes of moderate intensity exercise weekly, or 75 minutes of high intensity exercise weekly, okay? So high intensity versus moderate intensity, I gave you a few examples above, and then the limitations as far as time commitment. We recognize not everyone can do that, but for those who have that ability, this is something you should work toward. This should be your goal. The other thing that's encouraging about exercise is that you don't have to do it all at once. So if you're trying to reach 30 minutes a day, you can do 10 minutes in the morning before your breakfast, 10 minutes before your lunch in the afternoon, and 10 minutes before your dinner in the evenings. That's a total net of 30 minutes a day. You don't have to do it all at once. Most importantly, find an activity that best suits you, right? One that you enjoy so you can sustain your exercise routine, ensure that you are always exercising within your own limitations, and seek medical advice if you have medical conditions preventing your exercise to make sure that it's appropriate. Get creative, set an attainable exercise goal. So if your goal is to exercise 5 minutes a day for 3 days a week, start there. If it's 15, start there. If it's 30 minutes twice a week, start there. But don't ever become stagnant. You need to set attainable goals. Once you've achieved them, move to your next goal. Be creative in your ways to get active, right? So do you like to dance? Dance for your exercise. Do you enjoy working out in the yard or in the barn? Do it if you enjoy that, working with animals or have that opportunity to. Make exercise social, something you look forward to each day. Group exercise. I know it's a little harder in our current culture, but maybe find an accountability and a walking partner where you walk and talk, or maybe make some of your workflow meetings a time where you can be active while you're talking. We've done that for years. Corporate individuals have had meetings on the golf course. No, there's no reason you can't have a meeting while walking and talking. It just needs to be able to shift the culture in your job if that's an opportunity. While I recognize not all jobs allow that, there are definitely those where that would be an opportunity. Utilizing exercise apps for motivation if you don't have other individuals to help keep you motivated. So sometimes they have kind of these virtual groups or accountability groups on the apps that would be good. Are apps that remind you on your phone, hey, you've sat for 14 hours today, it's time to get up and move. Home exercise routines, our home has become our workplace, our home has become our gym, our home has become a lot of things. So organize your space in a way that makes sense. I have patients and individuals who I know who live in very small, very small apartments or studio apartments to the degree where it's 200 to 300 square feet. What they've done is they've purchased a rug and they said, all my work will happen on this rug. If I'm not on this rug, I'm going to either be doing things personal, or over here is my mat where I exercise. And anytime I'm on this, I'm exercising. So they're separating those things even in such a small space. But develop a home exercise routine if that feels best for you, especially for your own safety in regards to current COVID culture. That might be a good option. Sleep and sleep hygiene. This is something else we have to consider. So studies have found that poor sleep is associated with weight gain and a higher likelihood of obesity. So what do we mean? So poor sleep can increase appetite, likely due to its effect on hormones that signal hunger and fullness. So think of it, you've had your dinner and now you're up late, whether you're working or you're just kind of can't go to sleep for insomnia reasons, or you're watching television. And then you get hungry again and you're kind of driven back to the kitchen to start snacking to kind of satiate or make yourself feel full. You're responding to that. What we recommend is that you go to bed, okay? And that you try not to consume those calories. Again, not after 7 p.m. Use water as a way to help you feel full. And then avoid nighttime feedings and snacks because the circadian rhythm has a direct effect on your metabolism. So getting sleep. Sleep hygiene is like, for example, people have televisions in their room, they're on their phones, the room is dark, they're lying in bed, but they have all of these lights, all of these things that won't allow their body to shut off and relax. So sleep hygiene is recommended where you have no lights in the room, it's dark, you do not have technology going or running in that space, which is hard because some people have trained their bodies to go to sleep with noise, such as a television running, right? The sound machines that are often used for children can also be used for adults. We recommend if you use one to have something like a natural sound, like raindrops falling or the ocean, for example, and not things such as, city sounds, for example. But that is all part of sleep hygiene, and it's directly related to obesity because of the hormone imbalance, and especially for those individuals who are eating or snacking on top of that circadian rhythm discord. Poor sleep can decrease your self-control and decision-making abilities and can increase the brain's reaction to food. So again, your drive to eat later at night is going to be higher than it is during the day. Think about it. People who've tried all of these diets and exercise, they wake up, they're motivated, but by the end of the day, they're exhausted, they want to treat themselves, and they don't have the capacity mentally to rationalize through not having that food. So, making sure you get to sleep before your brain starts to tell you you've got to eat again is a good thing. Poor sleep may decrease your resting metabolic rate. So if you don't get enough sleep, that resting metabolic rate is actually going to slow. Adequate sleep helps prevent insulin resistance. So your body will respond to insulin more appropriately when you are able to sleep. Again, this is a big hormonal issue, right? The circadian rhythm. So, are you overwhelmed with all the weight loss diets and which is the best and which should I choose? So as you know, there's many diet programs available to encourage weight loss. And there's some that I've included here. The one that we recommend most and that has the most data proof behind it is a Mediterranean diet. A Mediterranean diet is going to be a more low glycemic diet. It's going to be kind of rich in healthy fats. It's going to help you kind of with your protein intake. They do a lot of grilled chicken. It's a diet full of vegetables, but again, in some of those very healthy fats. So Mediterranean diet is the one that we do highly recommend. We also recommend a certain population of our patients intermittent fasting. A lot of people think that means that you just can't eat for 48 hours, and that's not true. So intermittent fasting, there are different modifications. So you may fast for a 12-hour period or a 16-hour period. But this is not a good option for everyone because it can dysregulate hormones in a perimenopausal women or individuals who are premenopausal. So we highly recommend working closely with dietitians, and that's why we often refer our patients to dietitians to make sure that they're choosing the diet best suited for them. Keto diet, some of these other diets, Atkins diet, low carbohydrate diet, all of these are really eliminating carbohydrate intake and focusing on proteins and fats. Diabetic diets, also a low glycemic diet. The DASH diet is one in which you're going to reduce your sodium and basically your sodium intake. And then there's other things such as Noom or these applications that will help you determine what foods you should or shouldn't eat. So there's a lot of them, but the ones that really stand out to us, the ones that have the most data drive to them is the Mediterranean diet and certainly intermittent fasting for the appropriate population. Does it matter which one you choose? The answer is no. Does not matter which approach that you select. If ultimately you consume fewer calories than you expend each day, that's your goal. So goal is calorie deficit. So I'm not saying everyone should consume 600 calories a day. That's not sustainable for a lot of people. But what I'm saying is you should have a calorie deficit based on your expenditure. So if you are not one who exercises routinely, we recommend fewer calorie intake for you, right? Because your body naturally is going to consume or burn off calories throughout the day. But the issue is that if you have more calories consumed than what you need for energy expenditure, as I said before, it results in weight gain. The goal caloric intake varies depending on an age, metabolism, and levels of physical activity, among other things. So women, this is a generalization. This does not apply to everyone. Please don't misunderstand this. But women should consume about 1,500 to 2,000 calories a day, and men 2,000 to 2,500 calories a day. Again, this is a generalization. This is a standardization. This is not true for everyone, as there's a lot of variance among individuals. Developing new dietary habits is not a simple task. Establishing a professional relationship with your nutritionist or dietitian can be very beneficial to your success. So we know that in partnership with the dietitian or nutritionist, you'll be able to discuss targeted dietary goals and discover ways to achieve your goals. So many people, have had experience with dietitians and nutritionists in the past, and they write it off as it's not beneficial. I would argue it's because we didn't approach the dietitian or nutritionist with the right approach. We all know that we shouldn't eat chips, cake, cookies. We know that. But what we need to do is we need to approach a dietitian and tell them this. These are the hours that I work. This is the time when I usually eat. This is the foods that I like. Here's the foods that I absolutely will never eat. Here's the hours that I sleep. What can I do to improve my diet, and what would be best suited to the lifestyle that I currently live? Now, we can't say that you only want to eat at 2 a.m. because that's the time that you're hungry. Obviously, there has to be adaptations to your own accord. But if you work third shift or second shift, you need to tell this dietitian what are the parameters. And that dietitian can work with you and create a tailored outcome for you to follow a dietary plan that makes most sense. The key word here is a dietary plan that is sustainable. All right, so the next thing is your support system, right? How can I talk about fatty liver disease with my support system, right? So this can be anyone, right? This could be family, it could be friends, it could be a support group that you find kind of dealing with the same conditions, a fatty liver support group. So develop a strong and consistent support group, because we see most success in these individuals. And just because you don't have a significant other or children or family members or close friends, that doesn't mean that this is not an option for you. It means you need to plug yourself in with people with similar walks in life, like support groups, to help you develop that support system and keep you consistent along your sustainable lifestyle journey. So it's important to be able to share your journey and fight against fatty liver disease with a strong and consistent support group. That's important. Just sharing about it is important. It's important that the individuals who make up your support system listen to you and seek to understand your disease and its potential consequences on your health. So they have to be able to listen. Sometimes our family is the hardest ones because they can be critical, right? And so they'll say, I'm not a rabbit. I'm not going to eat all that lettuce. You expect me to do this? Well, if you're choosing to cook this way, there's no way I'm going to do that. So people who are supportive, especially if you live or coexist with them in the same space and share meals with these people, it's really good to explain to them what are the consequences of the disease. How is it that you can improve this outcome for yourself? And sometimes that might mean that they have to walk this journey with you. They may have to start eating more vegetables. They may have to start choosing the lean protein instead of the high fat things such as deep fried, bacon, or some of these cold cut lunch meats that we're not recommending that you have. So that's a hard feat. Again, a hard prescription, because not everyone is going to be on the same page. So just because they coexist with you, share a space with you, as a significant other, or whatever they are in your living space, I recommend that if they're not the support person, okay, if they're not willing to be supportive, you seek your support from someone else who is. It doesn't mean just because they're not on board doesn't mean you can't have this journey towards health. It makes it harder, but it means you look for your support in this journey and maybe other places. We know that lifestyle changes are more likely to be successful if the individuals who make up your support system get involved, hold you accountable, encourage you, walk the journey with you, promote the sustainable lifestyle changes, and seek to make the challenge a success. So that is our recommendation, okay? All right, let's see. Okay, and so a lot of resources here we have for you guys, for those who are interested. Again, this lecture is going to be posted in the next mailing for the reminder for our upcoming Part 3 series. You will have access to Part 2 and Part 1 as an archive in case you were to have missed it or are joining us late. Here's resources here for you, and I would like to take a moment now and entertain any questions that you might have.
Brad, we have a few questions from earlier in the presentation. They're in the chat box, but I can let you know what they are if you need me to.
Yeah, I'll just take a look here. Yeah, if you can read them, that would be great.
Sure. All right. So our first question is metabolic syndrome a condition that should be treated on its own? I'm guessing the lifestyle changes address it as well.
Yeah, good question. So yeah, we treat metabolic syndrome and we treat this specific thing. So if it's a hypertensive patient, we will kind of bridge them with antihypertensive or medication that treats high blood pressure, in that short term. But we encourage those lifestyle changes because that's the sustainable change. Maybe you won't need the blood pressure medicine if you start eating healthier, losing some weight, those types of things. So metabolic syndrome, we do treat in silos depending on what has given you that diagnosis, but only as an adjuvant or a bridge to get you there. The only people who remain on these medications are people who aren't successful in that lifestyle change, if that makes sense.
Okay, and there's a second part. This person has F2 NAFLD with intermittent inflammation, and they're asking, does NASH require constant inflammation?
Also a wonderful question. So the journey between NAFLD and NASH can be a fluctuant thing. So for example, if you were diagnosed with non-alcoholic fatty liver disease at some point in your life, the propensity of moving to NASH is inevitable if you don't make any changes. So if you continue to have fat at the site of your liver, it will eventually turn into NASH. And so NASH is what's caused that fibrosis stage 2. NAFLD has never caused fibrosis stage 2, nor will it. The presence of fat doesn't do that. But when the liver becomes inflamed, the scarring will ensue and you move up that pendulum if it's unaddressed. But say, for example, like you've lost some weight at a juncture in your life. Say, for example, in your 30s, you develop fatty liver, late 30s, you develop NASH, you develop F2 as a result of that into your early 40s, and then you've lost some weight. You got rid of that. You've lost 5 to 10% of your body weight as a response to that. And then now you no longer have the inflammatory response. So the good news about your liver is that fibrosis stage 1 or 2 can actually improve. If you ever reach fibrosis stage 3 or 4, which is advanced fibrosis, there is no improvement from that scar. The liver will forevermore be scarred. But yes, you can fluctuate between NAFLD and NASH depending on what your body is doing or you're doing to your body.
And please let us know if that did not answer your question or if you have any questions after hearing that.
Are there any other? Okay. Well, I will remain, and Adrian and I will remain here just for a couple more minutes, but we do want to thank everyone who's attended today. We really do appreciate your time and for learning a little bit more about fatty liver. And we do invite you to join our part 3, which will be happening on the first Friday next month. So September, the first Friday of September from 12 to 1, and you will receive kind of the invitation via email as you have for the past 2. Thanks again. I hope you all have a wonderful day.